So welcome all of you to our new class, and today we are going to deal with the unit 7. So the introductory class was over, and today we will start with the first topic or first content in the unit 7, that is admission to the hospital. So from the term it's very clear. So we are going to see how a patient gets admitted into a hospital, or how the patient gets an entry into the hospital. So first we will see the definition of admission. So admission is defined as allowing a patient to stay in the hospital for observation, investigation, treatment and care. So it's just a procedure, or it's a method through which a patient gets an entry into the hospital patient list, and we are giving the patient permission to stay there in the hospital for the purposes of observation, investigation, treatment and care. So for what all procedures the patients are getting admitted to the hospital means for a purpose of observation. So observation means we need to make the patient stay inside the hospital so that we can analyze, go on assessing and find out what are the changes being taking place, or what are the signs and symptoms that are present in the patient, so that we can identify what is the patient actually is affected from. The next thing is investigation. So investigation means we need to go for certain test in the sense that maybe blood test can be done, any scanning can be done, and x-rays can be taken. So many type of tests are available, and we are doing or applying it on the patient to identify or to find out what is the disease or what is the illness present in the patient. So this set of procedures what we are applying on the patient is called as investigation. The next is treatment. So treatment means after finding out the exact illness present in the patient, we are giving treatment for that or medication for that. Not only the medication, it can be medicine or any surgery if needed, or we can go for some nursing support or nursing care also. So these all are included in the treatment. So whatever we does on the patient for preventing or to avoid or to kill the bacteria or illness that is present in the patient can be called as the treatment which is provided. And care. So care is nothing but what all procedures we are applying or what are services that we are providing to the patient by all the doctors, nurses and other supportive healthcare team is called as the care. So these for all these observation, investigation, treatment and care, we are allowing the patient to stay inside the hospital, and this procedure is called as admission. So hope the definition is very clear to you. So here we can see another definition of admission. So it's nothing but it's the entry of a patient into a hospital ward for their therapeutic diagnostic purposes. So the first definition, which was little more elaborative and simpler form, here they have used some medical terms. So therapeutic and diagnostic purposes. So these two words may be familiar to you, as I have already explained these two terms in the terminology. So it's a simplified form, and it says that it's entry of a patient into a hospital or the ward of the hospital for the purposes of therapeutic or diagnostic functions. So therapeutic and diagnostic functions means same thing. Therapeutic means treatment modalities. Whatever care we are giving, whatever treatment or medications we are giving, or any surgical procedure we are applying, these all comes under the therapeutic purpose, that is treatment purpose. The next is diagnostic. So diagnostic means to diagnose, to search or to test on the patient. So patients may be coming without knowing what's the reason behind their illness. So to find out what is the exact reason behind their illness, we will go on apply many tests on the patient. Test in the sense blood test, scanning, then x-rays can be taken. So these are certain tests that can be applied on the patient, that is for finding out what is the disease being affected, or what is the organism, or what is the bacteria or virus being present in the patient body which is causing the illness to be claimed. So that all investigatory purposes will be coming under the diagnostic methods. So that's clear. So therapeutic means treatment, diagnostic means we are trying to investigate or put some investigation on the patient to identify the actual reason of illness that is being occurring in the client. So for that we are allowing or giving an entry pass to the patient. That procedure is called as admission. So both the definitions are here and I have explained what it means by admission. Then there are certain purposes of admission. So why a patient need to be admitted in the hospital? Why the patient cannot be treated as an outpatient? Outpatient in the sense the patient who stays outside but takes the treatment from the doctors from the hospital. Why the patient need to be admitted or allowed to stay in the hospital? There are certain purposes for that. So the first purpose is to undergo evaluation and treatment. So a patient who needs a long-term evaluation needs a further more deeper investigation into his illness. So such patients need to be stayed inside the hospital and go on with regular evaluation. Day 1, day 2 evaluation is needed, and then only the patient can or the doctor can end up into a conclusion that what is actually happening in that particular patient. Then treatment. So the patients those who need a long-term treatment or a close observation and close treatment or a direct treatment needed, such patients need to be admitted in the hospital. Then second is to know what is really happening in his or her body, right often to be fixed. So maybe the patient may be coming to the OPD, that is the outpatient department, consult the doctor, and at the first sight itself the doctor is unable to fix the problem or unable to identify what is the problem actually or what is actually happening in that particular person's body. The doctors may need some more time to find out the actual reason. So for that they will be admitting the patient in the hospital, and day by day they will be investigating or putting many tests on the patient and finding out the actual reason of that illness. So for that purpose they need to get admitted in the hospital. Then next purpose is to provide emotional security to the newly admitted patient and his family. So there are some patients, once they come to know that they are having some serious illness, they will have some emotional insecurity. Emotional insecurity means, suppose for an example I can tell, if you hear that any of your relative or any of your close relative is having some serious illness, so immediately when you hear that you will get into a sadness. So that is an emotional insecurity, you feel sad for them. So same thing will be felt to the patient itself when they hear that they are having some serious illness. They will also get some emotional disturbances. So for relieving those emotional disturbances, we need to get the patient to be admitted in the hospital, and their family also needed some assurance and support from the healthcare team to recover from that emotional instability or insecurity. So these are the purposes of admission, and these are all the reasons why the patient is needed to be admitted in the hospital for the treatment. There are two types of admission that we can see. So first one is an emergency admission, second one is a routine admission. So we can see in detail what is emergency admission and routine admission. So emergency admission. So emergency means there is an urgency, there is an immediate attention needed. So such type of patients who need an immediate attention, that admissions can be called as an emergency admission. So the patient may not be having any serious illness before. All of a sudden the patient is encountered with some problem or encountered with some illness, and at an emergency, at an immediate attention is needed, medical attention is needed. So the patient will be taken to the hospital and immediately the patient will be cared. So that admission is called as emergency admission. So we can see the definition. In this, the patients are admitted in acute conditions requiring immediate treatment. For example, we can say patient with RTA. RTA means road traffic accident. So that accident may be happening all of a sudden, and immediately the patient will be taken to the hospital and the admission will be taking place. So that type of emergency situations are called as emergency admission. The next is poisoning. So poisoning also happens all of a sudden and they need immediate care or medical support, otherwise the patient may end up in death. Then burns, then cardiac or respiratory emergency. So any heart attack if occurring, that is cardiac emergency. Respiratory emergency means any breathing difficulty occurring. The patient is having any wheezing. Such type of patients may need an immediate support of oxygen. Otherwise, the patient may collapse and die. So in such cases, the care is very emergent and very necessary or urgent care is needed. So such type of patients will be taken very fast through the casualty. So for such patients, for entry, we cannot wait for longer time. For such patients, we will be opening the casualty and we will be taking the patient to the casualty, and through the casualty or emergency department, the patient will be admitted. So that is emergency admission. Next is routine admission. So routine means daily, what is happening as usual, normal term, normally what is taking place, and they will be getting an admission to the hospital. So in this, the patients are admitted for investigation, diagnostic and medical or surgical treatment. Treatment is given according to patient's problem. For example, patient with hypertension, diabetes mellitus. So in such patients, patient who are having hypertension means BP, blood pressure is high, or diabetic mellitus means sugar is high. The sugar level, the patient is having high level of sugar. So such type of disease conditions are occurring. They are having a regular time. Once it appears, it may not end up. So regularly the patient will be taking some treatment from the hospital. In such patients, they can wait for little time to get the care. So there is no emergency for such patients. So we can routinely come to the OPD session, that is the outpatient session, consult the doctor, and the patient get admitted on advice of the doctor. So such routine procedures are called as, or slow procedures are called as routine admissions. Okay, routinely. That means there will be a pattern. Once in a month or twice in a month, the patient may be coming to the hospital and getting admitted for any surgical management or any medical management or for further treatment or investigation. So such admissions are called as routine admissions.